This is Fauzi النادي, Professor of Anatomy and Embryology at Faculty of Veterinary Medicine, Cairo University, Egypt. Today I am presenting some of the specimens I preserved using a new technique. The specimens, as you'll see, are very flexible, have no offensive odor. The specimens even could be dissected after the process of preservation. I hope this will replace use of animals in dissection and will be very helpful in other disciplines.
This is stomach of a horse. We see this is the parietal surface of the stomach, the cardiac opening and the pyloric sphincter and the duodenum. We see how flexible the specimen. The external features are obvious and the internal features as well. We see the mucous membrane, how it is divided into glandular area. This dark area is the glandular region, and the pale area, this is the non-glandular region, separated by the margoplicatus line. Inside the stomach, we can see the Gastrophilus equi larvae fixed inside the stomach. Another specimen also of the stomach of a donkey. We see the stomach and the spleen. The gastrosplenic ligament is very clear, very flexible. The blood vessels also are clear. The short gastric arteries to the greater curvature of the stomach and the splenic branches to the spleen. The greater omentum also can be seen. The internal features also can be dissected and seen. This method of preservation provides flexibility that allows you dissect the specimen even after preservation. As we see, we can open the stomach to see the internal features. The student can make any section, cross section of the esophagus to see the star-shaped lumen. It has no odor. It is almost dry, as we see, very flexible. If it's compared to the specimens preserved by plastination, these specimens are more flexible and can be dissected even after preservation. This is a part of the stomach of a buffalo calf, showing the reticulum. We can see the honeycomb appearance of the reticulum, the part of the esophageal groove, and the apomesum. This is the apomesal folds, very clear, and the torus pyloricus part. Another specimen demonstrating the liver of a donkey. This is part of the diaphragm, as we see, and these are the lobes of the liver. It is dry and not sticky. The bile duct is apparent and the external features are very clear. Also, this is another specimen of the buffalo calf, showing the liver with the gallbladder injected with latex colored with green. the external features, as we see, are very clear: the papillary process, the caudate lobe, and this is part of the diaphragm. And this is the parietal surface of the liver. This is the coronary ligament. Another specimen showing the lung of a donkey and the heart. The two lungs appear with the lobes. The heart is sagittally sectioned to show the internal features of the heart. We can see the moderator band or septomarginal band here, the chordae tendineae, and the cusp of the right atrioventricular valve. And here is the left ventricle with the left atrioventricular valve. As we see, the specimen is flexible. We can make dissections. We can see the aortic valve here. The auricles is very flexible and can be dissected. The coronary arteries also can be colored if we like. If it is not injected before preservation, it can be colored or colorized after preservation. This is a viscera of a cat. This is a viscera of the cat, showing the lungs, the heart, and the pericardium, the diaphragm, the liver, the small intestine with the jejunum, and the rectum, in addition to the urinary bladder and the uterus. We can see the uterus, V-shaped uterine horns, and the ovary. Such specimens will be very helpful for the students and veterinarians to understand the position of the organs in case of surgical operations. Here is the kidneys, right kidney, and we can see the subcapsular veins apparent on the surface, and the left kidney on the other side. This is the model of a guinea pig. It is a guinea pig specimen, preserved also by the same technique. We can see the viscera, the thoracic viscera, the lungs and the heart, the liver, and the gallbladder is injected with green or latex colored with green. We see the small intestine, the jejunum, how the mesentery is well preserved and flexible. The jejunal blood vessels are very clear. The large intestine also is apparently preserved. This is a bat specimen. We can see how well it is preserved, flexible, and the internal features could be dissected, as we see how it is flexible, and the muscles, the pectoral muscles, the viscera could be dissected if we want. This is a model or a specimen of the paranasal sinuses of a donkey and the brain, sagittally sectioned. We see the internal features of the brain, cerebrum and cerebellum and thalamus and corpora quadrigemina and aqueductus sylvius, and the bones, medulla oblongata, and the other structures are very clear. This is the second half of the same specimen. Supposed to be like this. In this model of the brain, we see it is slightly shrinked, and it is preserved with both eyes attached to the brain, and we can see the optic chiasm. Also, another specimen of the brain, we can see how the brain size is not affected greatly or not shrinked. This is a sagittal section of the brain of a donkey with the dura mater. This is a specimen of the cerebellum, part of the brain stem. Spinal cord with dura mater, part of the spinal cord, and medulla oblongata with the dura mater. All the specimen can be preserved in boxes, plastic boxes like this. This is a specimen of the eye of a horse. We see the upper eyelid and lower eyelid, the cornea and part of the sclera. The muscles are dissected. All the bulbar and part of the palpebral muscles are dissected. It is very fleshy and very flexible. The injected blood vessels appear very well as well. The optic nerve, so part of the lacrimal gland and other muscles. Still, we can make sections as we mentioned before because it is flexible. These are viscera of a dog. This is the lung. This is the right lung. And here is the heart within the pericardium. We opened the pericardium to see the heart. And we opened the heart to see the interior, right ventricle and left ventricle. The diaphragm, the liver with the lobes, the part of the pancreas, the duodenum, the stomach, the greater omentum. This is the greater omentum, part of the spleen or spleen, jejunum, rectum, descending colon and rectum. This is the urinary bladder with the middle vesico-umbilical ligament and the two lateral vesico-umbilical ligaments. These specimens have been preserved for several months so far. It is not affected by anything, kept in the room temperature. It doesn't need special equipment for the process of preservation. The chemicals are available. It's not expensive, and it doesn't need any freezing or special requirements for preservation. It can be kept, and the whole process is done at room temperature. This is another specimen of a chicken. As we see, the different structures, the trachea, the esophagus, the crop, the heart, the liver, the gizzard, all the structures are clear, the duodenum and the pancreas, small intestine, and everything is clear and apparent. This is a fetus of a goat, also preserved with the same technique. It is flexible and preserved for a long time. It has been for about 8 months so far. This is a head of a donkey fetus. We sectioned the head and we colored half of it. We see it is flexible, showing the brain, sagittal section of the cerebrum and cerebellum, and other structures are well demonstrated. Also, this is a fetus of a horse. It was aborted and preserved with the same technique. We see how it is flexible, even though it has been eviscerated. Another specimen showing the corium of the foot of a horse, the laminar corium and the coronary corium, and the solar corium and frog corium. This is also corium of a donkey, showing the laminar corium and the coronary corium, solar corium and the frog corium. This is the intestine or GIT, gastrointestinal tract of chicken, showing the esophagus, crop, and posterior part of the esophagus, proventriculus, gizzard, and the duodenum with the spleen, with the pancreas in between, the two cecae, this is kidney of the buffalo calf. We see the renal capsule and the fissured kidney. We can make sections. Larynx of a donkey. Larynx of a donkey, showing the epiglottis and the corniculate cartilage, adductus laryngeus, and the part of the soft palate, and how we can explain how the dorsal displacement of the soft palate occur and obstruct the adductus laryngeus. And the other structures also can be dissected and shown. This is the esophagus, trachea, cranial laryngeal nerve, and thyroid lamina of the thyroid cartilage. This is specimen of face of a donkey, showing the muscles, blood vessels colored, and the muscles also are colored. The nerves are colored, the infraorbital nerve, the facial artery and its branches. The muscles are colored and very clear. As we mentioned, the specimen can be dissected after preservation. Here we dissect the masseter muscle and show the muscles and structures underneath. We see the transverse facial vein and the deep facial vein and the buccinator vein and buccal vein, the facial artery, facial vein and parotid duct. The other side showing the sagittal section. You see how it is flexible and still can be dissected. This is part of the guttural pouch, opened. Falx cerebri of the brain and tentorium cerebri. This is a cross section of penis of a calf, showing the retractor bulbi muscle and the urethra and corpus spongiosum and corpus cavernosum, though it is fibroelastic penis. This is a small frog, specimen of a small frog. We can see the lungs, the heart and the stomach and the viscera, small intestine. This is a forelimb or thoracic limb of a donkey, preserved by the same technique. This is the skin. We kept the skin for sake of the surface anatomy, so the student can imagine the prominent palpable features over the skin. We can see the different muscles dissected and still flexible. We can cut through the muscles to show the different structures. This is the long head of triceps brachii muscle, and this is the lateral head of triceps brachii muscle, and the tensor fascia antebrachii, the caudal part. The antebrachial fascia, the superficial and deep antebrachial fascia, also are preserved and still very flexible. The muscles also are dissected. The nerves dissected and colored. Everything still flexible, as we see. On the other side also we dissect the different muscles and colored the arteries and nerves of the brachial plexus. Another specimen of a mule, showing part of the forelimb. This is the carpus or knee joint, and this is the elbow. We kept the skin so that the student can imagine the surface anatomy. The muscles can be dissected. This is the antebrachial fascia, and the different muscles are preserved. This is the lateral surface, and this is the medial surface. The same, the antebrachial fascia is apparent, and the muscles can be dissected and reflected if we want, in addition to the blood vessels. This is the biceps brachii muscle. We can dissect as if it is fresh specimen. This is a dura mater of the brain and showing the different parts like the falx cerebri and the tentorium cerebelli and the diaphragma celli. We see how it is preserved in a good condition.